Hi students, I am going to go through the MS-DRG POA encoder assignment. So let's just start here with case number 1. We have admission date 1/4/2024 and discharge on 1/9/2024. Couple of different things we need to look at. Disposition, the patient went home. The patient is a male, 5 years old. Okay, and then they kind of come over here through the whole thing. One thing I want you to remember is I did put in the admission diagnosis as fatigue. This is not the principal diagnosis. That's going to be just the admission diagnosis. Usually your admission diagnosis is going to be integral or related to the principal diagnosis. So let's get these all mapped in. I'm going to have a bunch of screens popping up here. So if I look at my first diagnosis, I'm going to type in anemia. And it is aplastic and idiopathic. So we go down to aplastic or subterm, and down here to idiopathic, which we have D61.3. All right, so that's going to be your first answer. Keep that in mind, and we only have one code. That fatigue code should not be listed, right, because it's integral to the anemia. All right, POA, yes, it was present on admission. And we have our first procedure here, which is the bone marrow biopsy. And when they do the bone marrow biopsy, keep in mind, we're going to look at the root of this. It's going to be extraction. So real quickly here, if I go to biopsy, and then I'm going to go right here to extraction. And we know it's bone, correct? We know it's bone marrow, correct? Okay. So on that note, we're going to go with, and let's see exactly where did they go from, the iliac area. Okay, so we go to bone marrow, iliac 07DR. Right. The next one we need, it was percutaneous 3, and we do know it was diagnostic. All right, so that's going to be the one procedure. And then we look down here, kind of move my screen again. What other ICD-10 PCS codes are assigned? This is for the blood transfusion and the platelet transfusion. So I'm going to go ahead and put those into our encoder. Okay, so now I have all this in the encoder. So we're going to go ahead and hit continue. And disposition, they went home. The admitting diagnosis, let's go back up here. It's going to be, remember, you only have one principal. It's going to be the R53.83. Hit OK. Let's go on to my, oops, I meant to, let's back that up. We're going to go to add diagnosis. Now our principal diagnosis, which is our anemia. And now I am going to go ahead and show you, I go to my anemia. I'm going to right click it for present on admission. I'm going to hit the Y here for yes and hit OK. And that's automatically put in. All right, so now I'm going to add my procedures. Okay, I went ahead and put in the 3 procedure codes. And so now our MS-DRG is 810, which is right up here. Okay. So a couple of different things you want to look at. That's the MS-DRG. Remember, we have the relative weight also. So keep in mind a few things. Let's go ahead and go to that next patient. Okay, so we have a female, age 69. It is very important, again, that we have the correct year, 1/3/2024. This will make a huge difference. So let's go ahead and see what Marielle has going on. She came in for a thyroidectomy, and looking through that, she has a goiter. She's been having trouble swallowing, breads, meats, frequent coughing, difficulty with lying on her back. Her past medical history includes a TIA, osteoporosis, sensorineural hearing loss. During the admission, her evaluation was tested. She has a total thyroidectomy, open surgical approach, and the pathology showed a multinodular goiter that is benign. So let's go ahead and get this coded out. So the first thing that we know, it's going to be the goiter, correct? Okay, so with the goiter, let's go ahead and put that in. And we know that it is the multinodular, okay? We want to go with, let's go ahead and look at here what kind it is. It is multinodular, and that is benign. All right, so when I pull it up here, it's E04.2, so we're good there. We also, here's the code for sensorineural hearing loss, and then we have the code for osteoporosis. Then we go into the thyroidectomy. I'm going to go ahead and put that in there. So if I go over here for thyroid, with a thyroidectomy and resection, remember the difference. Resection, they're taking out the whole thing, where excision's only partial. We want to take out the whole thyroid because they did do total. It's 0 GT, and then we have K, thyroid gland, and we know it was open, ZZ. All right, and the multinodular goiter is an N for POA indicators. True or false? This is false, because they did come in and they had the goiter there. Okay, so keep in mind with that. All right, I'm going to go ahead. Let's get everything plugged in to that. So back up that. All right, so we have, once again, I'm going to start off here. We have age 69. She's female. 1/3 year 2024. Discharge 1/9/2024. Okay, so we have the goiter put in. Let's go ahead and add a diagnosis, which we have up here. I'm going to add this all in. Okay, so with this right here, my MSTRG 627, relative weight is right up here, 1.236. Keep that in mind. All right, so for this last one, I'm just going to talk about that. I'm not going to log anything in. It's just giving you the codes. Okay, it's giving you the procedure codes. The hospital base rate is $7,450. And then again, it's very important that you put in 12/26/2023, discharge 1/3/24. Okay, so with the next one here, the DRG is going to be $640. Reimbursement, you need to figure it out, is $9,798. So remember, when we talk about relative weights, you take the relative weight times the hospital base rate, which equals 9,798. I do not round it up to 800. The only time you round it up is going to be when you have, if it would come up to pennies or cents on that end. Okay, any questions on this assignment, please reach out. I'll be happy to take any questions.